The surgical treatment of tuberculosis of spine is not to limit the progression of the disease. Remember, the surgical treatment is just to, based upon the stages, based upon the condition the patient is presenting with, what is the surgical management? The surgical management of TB hip joint, tuberculosis of the hip. Now, surgical management is concerned, there are several options. One is girdle stone. Now, what happens in case of girdle stone arthroplasty? Girdle stone arthroplasty is actually the removal of infected, that means removal of the diseased head of the femur. That you remove the head of the femur. All right. Then you will ask that if the head of the femur is removed, then how the patient will manage to walk? The patient, after the excision of this head of the femur, the patient is placed on a bed rest for a period of 1.5 months by applying skeletal traction. Now, in this period, there will be a formation of a fibrous tissue at the site of the site which was previously occupied by the head of the femur. Then after 1.5 months, you will ask the patient to walk without support. Once there is enough fibrosis, which is constituted kind of the fibrosis, which is firm kind of the fibrosis which has happened at the hip joint, then you will ask a patient to bear weight on that affected limb. Now, what there is a provision of, actually what you are providing by performing this girdle stone arthroplasty, actually it is not a good procedure to go ahead with. All right, it is not considered to be the best surgical management to go ahead with. But what you are providing to the patient, there will be a provision of painless, there will be a painless hip, but there will be a hypermobile hip. The mobility of the hip joint will be increased because of the restriction of any articular surface kind of the congruency. But at the same time, there will be a short limb that you are providing. All right, because when you have removed the head of the femur, there will be a proximal migration of the greater trochanter, as a result of which there will be a considerable shortening of the affected limb will happen over a period of time. So this is what you are providing with girdle stone arthroplasty. Actually, it is not a good method to consider, but for those who are extremely poor, who cannot afford a total hip replacement or any other surgical procedure, girdle stone arthroplasty is a better mode of is a option which is there, always there with you, provided you have to explain it to the patient that what you are going to be left with. You will be left with the unstable hip, the short limb and unstable hip. It is not a stable hip. All right. So these are the disadvantages of this particular surgery. Then the second option is arthrodesis. Arthrodesis means fusion of the joint, and today it is crime to perform this arthrodesis. So arthrodesis is something which you can learn in order to know about the options provided, but you should never perform. Arthrodesis means fusion of the joint. Now, what you are going to provide in this case of fusion? The second option is arthrodesis. Now, arthrodesis means surgical fusion of the joint. That means you are fusing the joint. Remember, it is a crime to perform this surgical fusion today. You should not go ahead with this arthrodesis because there are other options also. But what you are providing, what there is a provision of painless hip. Because once you have fused the hip joint, there will be no movement permissible. And once there is no movement permissible, that means there will be no pain. So painless hip, but at the expense of immobile hip. All right. But at the expense of the immobility at the hip joint. So it should never be performed. All right. The outcomes of this surgery are deleterious. It is so much limiting to the patient. The patient will become permanently disabled. And finally, the third, which is very commonly performed, is the arthroplasty, the total hip arthroplasty. That means total hip replacement. Then you will say that, total hip replacement is performed by placement of the implant. You have to go for the acetabular cup, you have to go for the stem, you have to go for the head, and you have to go for the insert. So an implant is provided, and that implant is also, this implant is costly for the patient, and the patient is suffering from an infective condition, remember. So if you perform this arthroplasty in an infective condition like tuberculosis, then implant can also get infected and there will be a failure of the surgery that you have performed. So what is the guideline to perform this? That arthroplasty is always performed 6 months after the initiation of after the initiation of ATT regimen. Alright. So first you put the patient on anti-tubercular regimen, then 6 months you have to wait. After 6 months, you get the relevant investigations done so that there is a decreased possibility of futuristic complication related to this implant placement inside. Alright. So that is a total hip arthroplasty, which is considered to be the best method of management for a destructive condition like tuberculosis of the hip joint. But if tuberculosis of the hip joint is diagnosed earlier, like in a stage of synovitis, in a stage of early arthritis, then the hip joint could be saved. It is for those conditions where the hip joint is already destructed, like in case of advanced arthritis. So, surgical treatment of tuberculosis hip joint, the indication is always the advanced arthritis. Alright, advanced arthritis is always the indication for performing the surgery. So, hopefully everything is clear related to this particular topic. Now, what all we have discussed in this tuberculosis of the hip joint are: point number 1, acetabulum, you came to know that it is the first most common site to be affected. Now, at this point, you are aware what are night cries, why the patient is feeling more pain at rest, because in the initial event when the patient goes for work, because of the periarticular muscular spasm, there will be all movement blocked at the hip joint. Alright. So, the patient won't be having any pain or limitation of pain, but at the time of rest, there will be relief of those spasmodic muscles, and there will be a beginning of the frictional movement. There will be reappearance of the frictional movement at the hip joint, which will lead to night cries. So, the patient will be having more pain at night. Then we have talked about the clinical features. We have very importantly discussed about all the stages of tuberculosis of the hip joint and their findings, on the basis of which your questions are going to be created. X-ray findings in particular we have talked about, and remember, reduction in the joint space is something which is earlier for tuberculosis of the hip joint, because it is something which we will be comparing it with. Alright. And finally, the management. In the management, ATT and traction is gold standard. You have to perform ATT and traction, put the patient on traction in any of the stages. But for advanced arthritic stages, you have to either go for these 3 surgical procedures. But remember, arthrodesis is something which is obsolete. You should not go with arthrodesis, either girdle stone or total hip arthroplasty. Alright. This much about the tuberculosis of the hip joint. Next is tuberculosis of the knee. The only thing that you have to remember under this heading, in particular tuberculosis of the knee, are the clinical features which ultimately will result in a typical deformity, which is known as triple deformity of the knee joint. And what are the components of this triple? What are the 3 components of this triple deformity of the knee joint? The first one is that the knee would be kept in flexion. There will be a flexion of the knee joint. Second, the knee, there will be posterior subluxation of tibia or the knee, simple, because it is the distal part or the distal fragment which is in whatever direction it is dislocated or subluxated. The direction of the joint is dictated in that way. Alright. So, posterior subluxation of tibia or posterior subluxation of the knee joint itself. And finally, the lateral rotation of the tibia. Lateral rotation of tibia or the knee joint. So, these are the 3 components of triple deformity of the knee joint. And these are the key key features, clinical features of tuberculosis of the knee. So, triple deformity of the knee, what are the 3 components? One is flexion, posterior subluxation of the tibia, and lateral rotation of the tibia. So, this is about the tuberculosis of the knee joint. As far as management is concerned, again, put the patient on ATT, put the patient on relevant traction based upon the stage the patient is suffering from. Then you can go with arthrodesis in case of tuberculosis of the knee joint, and finally the total knee replacement. So, these are the surgical options which you have to go with. But as far as your questions are concerned, majority of the time the examiner confines him or herself in asking about the triple deformity of the knee joint. Alright, and what are the components of the triple deformity. Next is just a named tubercular condition, that is Chiari-Sicca. It is actually the tuberculosis of the shoulder joint. And why is it given such a name? Because it is a dry kind of the tuberculosis. Dry tuberculosis means that there is no abscess formation. This question has been asked multiple of the times, that in which of the following joint tuberculosis there will be no abscess formation. So, it is the shoulder joint, and that is the reason why it is called as Chiari-Sicca. So these are the 2 points that you have to remember in this particular condition. And finally, spina ventosa. Spina ventosa is actually the tuberculosis of the smaller joints in hand. So spina ventosa is the tuberculosis of small joints in hand, because there is a confusion that spina ventosa could be a tuberculosis of spine. No, it is not the tuberculosis of spine. That is pot spine. Spina ventosa simply is the tuberculosis of the small joints in hand, like metacarpophalangeal or interphalangeal joints. So this is what the spina ventosa is. Next, finally, what is the natural outcome of the joint infections? We have talked about the joint infections like tuberculosis and the pyogenic infections like septic arthritis. Imagine if the joint infection is continued to progress without any intervention, without any medical intervention, without any surgical intervention, then how ultimately it will lead to a progression of, and what ultimately will become the outcome of that joint infection. So this is what we are talking about. Again, imagine a patient suffering from a pyogenic joint infection or tubercular joint infection, and it is continued to progress, means no surgical or medical intervention was given to a patient. Then what ultimately will be the outcome of this joint infection? So natural outcome of the joint infection is always ankylosis. Ankylosis means pathological fusion, that it is because of the pathology, or it is because of the pathology, that the joints are fused now. Now this ankylosis can be of 2 types. There are 2 possibilities by which the joint can be fused, pathologically fused. One is fibrous ankylosis and the other one is bony ankylosis. That means a bone above and a bone below, they are fused by a fibrosis in between, that is fibrous ankylosis. Other hand, a bone above and a bone below are fused by a bone itself. Alright, so there will be a continuity of the bone, that is bony ankylosis. All tubercular infections, so tuberculosis of all joints, it ultimately progresses to fibrous ankylosis, except, but there is one exception, so except TB spine. Alright. On the other hand, all pyogenic infections of the joint, that means all abscess forming infections of the joint, they heal by bony ankylosis along with TB spine, because TB spine is an exception. TB spine is not healing by fibrous ankylosis. The ultimate natural outcome of tuberculosis of spine is a bony ankylosis, and there are reasons for that, but you need not to go into the depth of those reasons. All you have to remember, it is the TB spine is one such exception which does not ankylose by fibrosis. It gets ankylosed by a bone formation in between the 2 suffering bones. So hopefully everything is clear related to this particular topic itself. So this is all what we have talked about as far as infections of the bones are concerned. Pyogenic infections, then tubercular infections. In the tuberculosis, because the most common site affected is tuberculosis of the spine, so we have talked about the TB spine, then second most common site is TB hip, and the third most common site is TB knee. Similarly, in case of pyogenic infections, we have talked about the acute and the chronic, with the varieties of chronic, but more importantly what you have to remember is the difference in between the primary joint involvement and primary bone involvement by the infection.